You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have board-certified oral surgeon, Dr. Tim Betita. Dr. Betita, welcome to the program.
Thanks for having me. Appreciate it.
Now, I know you brought a stack of photos, so we'll get to as many of those as possible. Who's the typical patient that comes in for dental implants?
Well, we basically have two groups of patients that come in. The first group, I would say, is the patient that has been on this long dental journey. They've been in and out of dental specialist offices. They've been back and forth between their general dentist and specialists, back and forth, getting lots of things done. Fillings, large fillings, root canals, crowns, gum surgeries, extractions done, everything you can imagine. So these people have had a lot of dental issues, and they've been told at some point that their teeth are no longer salvageable. They cannot save them anymore. They have to go to a denture. They have to get them all taken out.
Okay.
They're experiencing bleeding gums, mobile teeth, dental pain, swellings. All of these things lead the dentist to say, we cannot save your teeth anymore.
Okay.
There's nothing to work with at this point. I think we need to talk about extracting all of your teeth. What are the ways of replacing teeth? Denture. That's what most people think. And so the patient's like, I don't want a denture. I do not want a denture at all. Is there anything that we can do to avoid wearing a denture?
Okay.
So they come to us because they know our reputation. They know that we can give them an option without giving them a denture. They know that their teeth are going to stay in their mouth. They're not going to come in and out. They're going to be able to eat the foods that they want, enjoy all the foods, eat the corn on the cob, the steaks that they want, enjoy life that way. And so they come to us because of that.
Okay.
That's their goal, is to keep living and keep teeth. They don't want to have to worry about taking a denture in and out of their mouth. And so that's the first group that we see. The second group of patients that we see are the ones that are already in dentures. They've been having denture problems for years and years. I don't like to call them denture wearers, actually.
What do you call them?
I like to call them people who have dentures.
Okay.
Because it seems to me that when you wear something, when you wear clothes, they conform to you, but I feel like patients are conformed to the denture. So the denture is wearing the patient. And so that's how patients feel a lot. There's a big bulky plastic in their mouth and it's uncomfortable. They have to use a lot of glue and adhesive to keep it in place. They come out at the most inopportune times.
Yeah.
And so they're fed up with this. And so they usually just avoid those social situations where that is a risk of happening. So those patients come to us because they want teeth on top and on the bottom, upper and lower teeth that don't come out. Okay. That's what they want.
Now, I know a couple denture wearers. They never complain.
They don't complain to you.
Okay. Okay, that's fair.
Why would they complain to you?
Okay.
They come to us, and it's a very intimate relationship that we have with our patients in our room. They unload their dental concerns to us.
Okay.
We are very open to hearing them. We get vulnerable with our patients, right? We understand their fears and their desires when it comes to dentistry, and people don't like talking about it, even with their close loved ones.
Is that right?
Yeah.
Now, I know you have a lot of photos. We looked at those in the green room, and whoever's watching that, I mean, these are, and I'm not trying to side with you, but these are dramatic changes. You know, I go into this thinking, well, it's just teeth. As you say, it's a lot more than that, right?
It is way more than that.
Let's talk about a little bit about your training. I mean, you're a medical doctor.
Correct.
An MD, and you're also a DDS.
Correct.
You're an oral surgeon.
Uh-huh.
And I was thinking, does it cost more to go to an oral surgeon? And what's your response to that?
Specialists exist for a reason, and it's to save time and effort and money for patients. So it's always better to get it done right the first time than to go somewhere else, have it done, and then have to redo it again.
Now, correct me if I'm wrong. So the way dental implants are typically done is you go to one place that does the surgery, like the oral surgeon. You go to another place that puts the teeth on top. And then you go another place to maintain them. At your center, you do both parts. You do it all right there. Is that why you do it so quickly?
That's part of the reason.
Okay.
Part of the reason. We have a huge process. We have a lot of different team members to support the patient and give the patient the best experience. And I feel that the doctor's experience, the doctor that you want to go to the most is the doctor with the most experience. Why? Because you want the best experience. The doctor with the most experience gives the patient the best experience. That's what I tell all my patients.
All right.
And so that's what I believe with any specialty.
So
in
experience
medicine,
matters.
Experience does matter. In our office, we have the surgical team, which is me, the surgeon, right? Then we also have a group of individuals, of specialists that are going to be making the teeth.
Okay.
A group of individuals that are experts at maintaining the teeth. So we do it all in one place. And so we're supporting you so the patient doesn't have to go from one place and come back and go forth over here. We make it really streamlined and real simple. Patients love that. It's a better experience. I used to do it the other way, where I would take the patients in and send them out. And a lot of my friends are currently still doing this.
Other oral surgeons.
Other oral surgeons, other dentists, they're all doing this the old-fashioned way. Now, we don't need to do that anymore. We're wasting a lot of time and money and effort for the patient. We can make it streamlined for everybody involved.
Okay.
What I tell patients is you want to go to a place that does it all in one spot, under one roof, has it all on location for you, so you can do the surgery, you can do the transformation, you can get your teeth maintained there, you can get your teeth delivered there.
All right there.
All right there. It's
Now,
way better that way.
You even make the teeth like in the other room. Like you have digital printers that make teeth. You have mills that make teeth. Is that right?
Yep.
That's on site?
Yep, we're pretty proud of that. So our digital process.
That's got to be rare. Is that right?
It's extremely rare. So where I would say less than 1% of the practices in the country are doing anything remotely like ours. And what we're doing is we're able to basically digitize the patient. We have 3D photos, we have 3D printers, we have 3D CT scans, we have the ability to take impressions of the teeth without the goop and choking on anything. It's fantastic. So everything's in the 3D
like you have little
world.
cameras that go in their mouth.
Yes.
So that's why you don't need the goop anymore.
It's amazing.
Okay.
It's amazing. So technology has come a long way, and we've taken the best technology out there, and we're putting it all together into this awesome digital process to where it's so much easier for the patient to go through this process, and we can kind of guide them through.
Good.
And because of that, we're able to put it into the virtual world, plan everything to the microns. And then we're able to print teeth, mill teeth, and make subtle changes here and there, specifically designed and customized to the patient's face and their personality.
It's very nice.
Yeah, it's awesome.
Now, do you think this is the future of dentistry? Like, let's say 20 or 50 years from now, dentures, like we said at the top of the show, no more dentures. Do you think there'll come a time where all dentures will be attached to something?
I certainly hope so. And that's my mission in life, is to make sure that that is the case. I want to make sure that people don't have dentures anymore. My grandma had dentures. She was told she was too old, which I believe is a myth about implants.
I mean, how old can you be to do this? What's the oldest patient that you've seen?
Well, last week I did a patient who was 93 years old.
93.
93.
Why would they want to do it at 93?
It's more important at that age. More important. Nutrition and health, one, is really important. You don't want to give somebody who depends on nutrition, so drastically in the later ages of life, to have something that comes in and out, is uncomfortable, gives them sore spots, and now they don't wear that, and now they don't eat the foods that they need.
But if you're 93 years old, are the implants more likely to fall out?
No.
Statistically? No.
No. Nope.
Okay, good.
Nope.
So
Not at all.
80 is young then. If 93,
Oh yeah.
so 75.
80
Did they ever
young.
come into your office and say, Doc, I'm too old for this?
I get that in every decade of life. My patients tell me that. Oh, I'm 40 years old. I'm too old for this. I hear that, and I hear 80-year-olds be like, well, I've got a good 20 years left. You know, like I always tell my patients, you're going to live to 100 at least, and so you got to plan your life like that. You can't just be like, well, who knows how long I'm going to live. We don't know how long any of us are going to live. We have an idea, but we don't know exactly how long everybody's going to live. And so you want to have the best quality of life, even at the end of your life.
What do they like most? Do they like what they can eat, or do they like how it looks?
That's an interesting question. So a lot of my patients, they focus on one or the other. Some of these guys come in and are like, I don't care about the aesthetics. I don't care about the looks of them. they can look like whatever, but I want to be able to function really well. I want to eat the foods that I want to eat. I want to eat that steak that I've always wanted to eat. Those guys come in, but then when they get their teeth, they're functioning really well, and all of a sudden they switch and they're like, I love how I look,
Okay.
They like change the way that they're smiling. They smile a whole lot more. They shave their facial hair. They're not hiding their teeth anymore. And they're
Selfies on Facebook, maybe.
Yeah, exactly. They're out there. They're out there on social media. Just it's like, look at me again. They haven't had that confidence in such a long time that they forgot. They forgot about it, and then they're reminded. Oh, I look good with teeth.
So the opposite's true too. Some people you say, all they care about is the way.
They come in and they say all they care about are the looks of the teeth. They're like,
Okay.
I want it to look very pretty, straight. I want something I can be proud of.
Okay.
And they come in that way, and then months later, after they have their teeth, they say, oh man, I didn't realize that I could eat salad again this well.
Okay.
Like salad is like a very healthy food. We want to eat it. It doesn't seem like it's a hard thing to
With
eat.
bad teeth, it's
but with
tough.
bad teeth, you can't grind on those leafy greens. You cannot do it, and so they forget.
Can you eat things like almonds?
Yeah,
Once you get this?
You can eat almonds.
Chewy things?
Yeah, chewy things again.
What about like a carrot raw with your front teeth? Or you have to be careful with that?
Oh yeah, I have patients all the time. The first meal that they have when they get their final teeth is this nice and solid bite that they have. They go out and they have a steak dinner. They have raw carrots, corn on the cob, and they like send me videos of them finishing their plate, cleaning the whole plate, eating it all without having to like grind it up, cut it off with a knife, smash it with a fork. None of that. It's fantastic.
You brought photos. What are we looking at?
I did. Let me share some of these awesome success stories with you. Okay. So let's take a look at this first one here. I've got a book here.
Is this a book like you have in your...
Yeah, we have this in our waiting room and in our consultation rooms. Go ahead and open to the first page there. You'd be surprised how many cases we see like this.
That looks very unusual.
It may look unusual, but human beings are really good at hiding the things that they are not proud of. Okay? Whether it's teeth or a mole on their face or whatever it is.
Yeah.
They're good at hiding it, minimizing it anyways. And especially with teeth, they just don't smile. They have facial hair. They try to cover it up as much as they can. So we get patients like this all the time where you wouldn't really suspect it. But he comes in and every time he smiles really big, you can see it. It's obvious, right? It's like, what are your thoughts when you see a patient or a person like that on the street?
Well, yeah, I mean, I've never seen anything like that, so it looks pretty bad.
It looks really bad. And patients like this lose a lot of confidence when they have teeth like this. They're not able to enjoy their life because they don't smile as much. They don't interact with their loved ones as much. Do you think people with teeth like that feel confident to approach somebody like that to ignite romance?
Probably not.
Not at all. Not at all. And so they're withholding themselves from enjoying life.
So what was his option? Denture?
So his option was a denture. He came and he was like, I need a denture, And so we hear that and we're like, no way. I'm not giving you a denture. Like you will hate it. You will absolutely hate it. I don't want to do anybody a disservice and give them a denture, right? So we were telling them our process about in one afternoon, we can transform your mouth, your teeth from horrible dentition, horrible teeth that look and smell terrible to something that they can actually smile with and be proud of.
Could something like this, like when I look at this before, so are you able to do it where you do the extractions and then give them the new teeth, upper and lower, fixed, that don't come out in one day?
Absolutely. We do it every day.
Okay.
All the time.
So you don't pull the teeth and wait?
No.
So,
Would you want that? I wouldn't want that.
I wouldn't, but I always feel like it's a little bit of an exaggeration. So you said as little as 2 appointments. If everything works out right, that means somebody watching this, let's say you had your schedule's open tomorrow. They see you, and then the day after tomorrow, they could have their new teeth.
Yep.
Really?
Yep. We do that all the time.
Okay.
So the way that our process works is we can have everything planned really quickly. We take out the teeth. We clean out the infection with the surgery. We're cleaning everything out.
Yeah, but if you have bad gums, can you do this? Like if you have gum disease, the gums are too bad to hold the implants?
That is a myth. I don't know where this comes from, but in fact, you can actually get your teeth extracted, the infection's all cleared up during the surgery process, and then we actually place the implants immediately, right then and there, and then we're able to give you a fresh new start with that, and then gives you new teeth that same day.
Is that right? And then, so no more bleeding gums or the bad breath associated with gum disease?
Exactly, it goes away.
It goes away.
We clean it out with getting rid of the source of the bacteria is the source of the solution, So getting rid of the teeth gets rid of the source of the bacteria, and everything's starting fresh. Clean, you can have implants, clean bone, everything's good. So I want you to look at the before and after here,
All right.
Would you say that he looks younger?
Yeah, he does.
Does he look more handsome?
That's
Does he
true.
look more sophisticated?
Yes, he does.
He looks more educated?
Okay.
Does he look like he takes care of himself and others?
Yeah, that's
Yeah,
true.
all those things are true. Does he look more confident in the second photo?
Yeah.
Absolutely. This is a major transformation for patients. Patients come to us all the time, bleeding gums, failing teeth, just falling out, mobile, and then they come in and they have that transformation done, and they leave, and it's the first day of the rest of
I
their
got to
life.
ask you about this because, and I'll put you on the spot here, but a lot of the dentists are doing these snap in, snap out teeth supported by implants. You don't like them. Why?
It's not me. It's the patients. They don't like them. It's still a denture. They
Okay,
don't like
that's
removing.
fair.
They don't like removing things. All right. They get lost. They break. So anytime something's removable in the mouth, it doesn't last as long. They just tend to get broken, and patients have more complications with them. With something that rocks in and out and snaps inside on top of implants, it causes other issues. The implants can fail more often with those types of restorations, and so we don't want those dentures.
You say there's maintenance on that?
Yes.
On the snap in, snap out
Yeah,
teeth?
there's always maintenance. No matter what, there's always maintenance. Yeah, and so you just have to repair it more with those snap in, snap out dentures. So I don't recommend those for patients. I
Well, that's what
recommend,
people want anyway, right? Teeth that don't come out?
Absolutely, they want teeth that don't come out. They don't want to have to worry about it anymore. If I gave to you, if you had to do 10 more things before you go to bed at night, or 10 more things before you get up, or right after you get up every morning, do you want to do it?
No.
No, you don't want more on your plate. You want less. So people don't want to worry about
So
it.
they just brush them just like regular teeth, and then
Yeah.
they go to the dentist every 6 months or once a year to get them
So
clean?
with these fixed teeth, the teeth that don't come in and out, supported by implants, so you have your regular dental hygiene appointments every 4 to 6 months like you normally would.
Okay.
Yeah. One of the big myths about patients, one of the big fears is like, oh, it's going to hurt too much. I can't go through
Well, it
something
does
like
seem
that.
painful.
Yeah, so that's why we offer sedation. So some people say they don't remember anything, but all of our patients remember very little of the procedure. We want to get them to a point where they're nice and comfortable.
Do they
So
like
they're
that you're a
surprised.
medical doctor, by the way? Because you're a medical doctor, oral surgeon, and a dentist. Do they like that? It seems like they would.
They do like that I'm a medical doctor. I've gotten that every day that I practice.
nice.
It's like, oh, you're a medical doctor? I trust myself more to your hands as opposed to somebody who doesn't have that kind of training.
Okay, that's good. So experience matters. I know that seems obvious, but are you that much better now than you were 5 years ago?
Oh, absolutely. I improve every day. Like every case that I do, I want to make sure that I do a better service. So I'm looking at all my cases, seeing how I can improve things here and there, and with the way that technology is advancing, you have to keep up with it.
Are you a perfectionist?
Yes.
Are you accused of being a perfectionist?
Yes. Yeah. Have you been talking to my wife? Yes.
Not good to have a husband or father who's a perfectionist, but as your doctor, yes, right?
Yeah, exactly.
Good.
Exactly.
Now, I'm going to rush you here. We're going to go through as many photos as we can because I know you brought a stack of
Okay.
them.
All right. So here's another before picture. Okay. So you say on that first case, oh, this is unusual. Here's another lady who doesn't like her smile. Okay. She wants to fix it. Her other option is a denture. And she came to us because she knows that we don't like giving out dentures. We don't like dentures. We want to give her something that she can be proud of. Okay. And so take a look at this next photo. All right.
Oh, that's really nice.
So let's take a look at the before and after. Let's compare them side by side. In the second photo and the after, look at her smile. Does it look more natural?
Yes.
Yes, it absolutely does. Does she look younger?
Yeah.
Does
That's
she
for
look
sure.
more vibrant? Does she look
Yes.
full of life?
Yeah.
Yeah, this is the transformation that happens. It's not just teeth. It is not just teeth.
I told you that, and that's probably why you're saying that so much. It goes just teeth, though. It's more. I mean, when they look in the mirror, what's that like? Like when they see themselves for the first time.
Oh man, that's the best part about the whole process. So at the end of the day, when we got their new teeth in. They haven't seen it. We've seen it. We're all around it. Everybody's in the office just like excited to like share this moment with them because it's so special. So now she can eat and chew whatever she wants. She's confident. She's full of life. This is the first day of the rest of her life. This
now,
is fantastic.
you say that most of these people haven't liked their teeth for like 10, 15 years or more before they even do something.
Yep.
And they all have a regret they should have done it earlier.
Absolutely. I say that all the time. That's the one thing that I say. I wish I would have done this earlier. I wish I would have known about this earlier. I wish I would have come to your office sooner. I hear that every day.
I got to back up about the denture wears. If you've been wearing a denture 10 years, you can't do this because you don't have enough bone.
Another myth.
It's not true?
Absolutely not true. So we get that all the time. I was told I'm not a candidate for implants because I don't have enough bone. I was told I was going to have bone grafts and then wait 6 months to 12 months before I even get the implants in. And then I have to wait even longer for the implants to heal. And then I have to wait for the teeth to be made. So that's a myth.
So this is what, just technique driven?
Part of it is technique. Part of it is experience that we have to be able to make it happen. So basically, with dentures, bone does resorb away. With bacterial infections in the mouth, bone resorbs away.
Okay.
When we clean all that out, we kind of slow that process down, but we have to look for the bone that the patient still has in order to place implants into good, healthy bone that's going to stabilize their teeth for the rest of their life. So as an oral surgeon, bone is my specialty, and I know where to anchor these implants in order to make it an option for nearly everyone, almost 100%.
Okay, good. We only have about 2 minutes left, and I know you have another stack of photos.
So
we'll kind of rush you through these because they are good.
Yeah, okay. So let me show you this one right here, patient without any teeth to begin with, okay? And then here he is with teeth that are fixed in with implants. Another case, partial, so she's missing most of her teeth, okay? Her option was a denture, right? She's been told she's not a candidate for implants. Her bone wasn't there. So we placed multiple implants for her, gave her a brand new start on life.
Now these teeth almost look like, because look, doing what I'm doing, I've seen a lot of before and after photos, and I'm not trying to side with you, but they look very nice. Is it because you have these scanners or whatever, this facial scanner that digitally produces the teeth based on their mouth, their lips?
Yeah. So
is that why they look so good?
That's part of the reason. That's part of the reason. We give the patients and the designers everything that they are looking for in order to get the teeth that they want. Okay. So we're customizing these teeth to the patient's personality, to their gender, to their age, to everything. We match it to the patient. Okay. And it supports their lips, their face, their smile. They look great because it fits with nature. It's dialed in. It's dialed in. Here's another one. This fantastic story. Changing his life around. Only has 3 teeth on the top.
That looks pretty bad.
That was really bad. All right. And then he's a young guy.
He wouldn't have expected this guy.
Yeah, you wouldn't expect that. You would not expect that this guy had that. He's a young guy. He was going to be in a full denture for the rest of his life. Not going to happen. Not
so upper and lower teeth that don't come out.
They come to us because they know that it's not going to happen. Yeah.
Now, when they're on the consult and they're giving you their hard luck story, do you ever get kind of excited where you're thinking, this is going to be so good? They have no idea how good it's going to be.
Yeah. Like when I first talk to the patient, I'm like, I'm going to go over your scan. I'm going to go over the findings here. We're going to talk about your options. Inside, I'm like bursting. I just wanted to come out and be like, grab him by the shoulders. Look at what your life could be like. You have no idea. Like, I really want to like take him under my wing and be like, look at what your life could be like. I want to show them the vision. I want them to catch that fire.
You love this, by the way, it seems like.
Oh, I love it.
And is it true that your daughter, I think you told me, your daughter wants to be an oral surgeon?
Yes, she told me that the other day. It made me cry tears of joy, but yeah.
That's nice.
She loves that.
Time for a couple more.
Okay.
Like literally a minute left.
All right. Let's do this one here.
Okay.
All right. Denture wear, right?
Oh my goodness.
He only had 2 teeth left. Now he's getting more teeth. Here are 2 gentlemen that didn't know how to smile. Like literally decades hiding their face, hiding their smile, not trying to show their teeth. Okay. Here's one before photo. Okay. And here's another gentleman. Look at those. Wow. Look at those smiles. Like, smile. Give us a good smile. Show us what we got here. Right?
So they're so used to not smiling. That's why they're making these funny faces.
They just.
That's what you think.
Yeah. They just try to hide it, you know? And then they have everything done for them, all right? And then just weeks later, right?
Wow.
Weeks later, they have this transformation. They learn how to smile again. Their life changes. It's not just teeth. It is their life.
You say they come back like 4 months, 5 months later. They're almost unrecognizable, like as far as personality.
Oh yeah, there's
Really?
Yeah, totally. They're out there dating again. You know, they're getting into relationships. They're going for that job promotion. They're starting new businesses. They're enjoying their time with their grandchildren more. Oh, it's fantastic.
It's a big deal.
Yeah, they come in joking and laughing with the front office, like having a good time.
And we have to bring this up because we'll get emails about it. Because Medicaid doesn't cover this. Medicare doesn't really cover this. The best dental insurance only covers like a very small portion.
Yeah.
So
Yeah, so you have to understand that our patients have financing options. They're financing this. They
how
know what
common
they
is
want.
financing this?
What's that?
Like every day they're financing?
Yeah, absolutely. When they know that it's worth it, they get financing options. Hands down, they do this all the time.
Okay, so no more dentures.
No more dentures.
Okay, final message. And we're out of time. Somebody watching this, they're one of the two groups: bad teeth, and they're headed to a denture, or they're currently wearing a denture. They've heard what you had to say today, or have to say today, and they're still skeptical. What do you say to them?
Come talk to me.
Okay.
You know, I would love to have a sit down. The first conversation is real easy. You know, it's just to see your options, what the findings are, what are your options, and I can tell you that almost 100% of the cases, their options are get dental implants, have the fixed teeth, change your life.
All right. Well, good. I want to thank you for coming to the show. Great stuff.
Yeah.
So if people want to know more, they go to your website. They can look at the before and after photos.
Absolutely. I can see it all
And
there.
I know you have a big team there, but do they ever get to see you every once in a while?
Absolutely. Absolutely. I'm there every day.
All right. Well, I want to thank you for coming on the show. Good stuff.
All right. Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.